So, welcome back. We are on the third and hopefully final rendition of Save the Mullet. So, we're talking about, of course, the science and, of course, the treatment for hair restoration. And we're at the probably the most important kind of pinnacle of the whole podcast. And we're talking about the really interesting and most cutting edge treatments of this type of medicine right now that we're going to get to. So it was worth the wait, don't you think so?
I totally promise, guys. It's 100% worth the wait. You guys have learned a lot about the history and the science behind hair loss. Right. So now we're really going to get into the solutions to hair loss.
So, I mean, last time we did talk about some of the more common treatments. We talked about, minoxidil. We talked about some of the other treatments, finasteride. We also talked about the low laser light therapy, which has really some pretty good research on it as well. So now we're going to talk about platelet-rich plasma, which has really good data, and it is one of the new cutting-edge treatments. It's been out for a good period of time, and we're going to talk a little bit about it, and we're going to talk about the efficacy, and we're going to talk about the science behind it, and we're going to talk about why I think that this is going to be one of the important treatments that we're going to discuss. We talked a little bit about it before on one of the other podcasts, specifically about skin treatments, but let's get into what the data is behind platelet-rich plasma with hair treatments, because I think that there's pretty good data when it comes to hair and platelet-rich plasma.
PRP we've seen really amazing results at the office.
Yeah. I mean, platelet-rich plasma, so when you think about with platelet-rich plasma, whenever you cut yourself, for instance, what happens is that you have certain cells that come to you, and those cells, one of the most important cells are the platelets. The platelets are those wound healing cells. They are the cells that come, and they're kind of the first responders. They're the ones that are there for you, that come to kind of help to get the important growth factors to kind of heal the wound, help to lay down the tissue that's going to be important to help the new skin that's going to be there present. So platelets are super important when you have some type of wound present. So that's the way I kind of think of a platelet. So that's why I think platelets are really important when it comes to this type of medicine.
I like that you call them the first responders. That really nails it.
Yeah, I mean, I think that that kind of gives the kind of good visualization of what platelets are, and so that's the reason why platelets have been kind of to the forefront of all this type of medicine. Now, platelets have been used in orthopedic medicine very successfully. When you think about the fact that athletes have been damaging and tearing ligaments, and they've been putting platelets into their joints and repairing ligaments with platelets. You think about how significant that is, the wear and tear of a ligament, that platelets can actually repair a ligament, what it could do to delicate tissue like skin and hair. That it's pretty impressive that it can repair a ligament, that you think that it could do some good things with skin and hair as well. I mean, when you really think about those factors. So here are the high points when you think about what platelets, what platelet-rich plasma is going to do. So the first thing is angiogenesis. A big word, means that it brings blood to the area. Is that a good thing?
Sounds like it.
Yeah, of course, because what it does is it's going to bring all the nutrients. Like blood is kind of like the, is the supermarket of the, of the skin. So, and of course, in this case, to the follicles and of the scalp. So it kind of gives all the nutrients, it brings the oxygen, gives you, it nourishes, the areas that, were dormant and kind of waiting for, that area to be kind of refilled. So when you have, that dormant kind of cells that are sitting there waiting to go into the, the more growth phase, you need something to kind of precipitate it. So, the first step to get things moving is the the angiogenesis. Also, reducing inflammation, and I'm going to talk a little bit about this. Again, inflammation is one of the biggest reasons why we do go into the phase of hair loss. The catagenic phase where we lose hair, because of the fact that when we have inflammation in the scalp, and we talked about like when you could produce inflammation by using traction, by putting yourself into ponytails or braids, you cause inflammation into those follicles, you're going to be damaging those follicles. But specific inflammation does damage to the follicles, and it could cause the follicles to cause the hair to be lost. So we want anti-inflammatory areas to the scalp.
So if it's the area of the follicle has been damaged by, you said, like wearing hats a lot, or tight scarves around your head, or like you said, put in a ponytail,
right?
A la the guy in Pulp Fiction. What's his name? Why am I blanking? John Travolta in his ponytail.
Right.
That can cause hair loss.
Right.
So we want to reduce inflammation around the follicle.
Exactly. So and so that's really important. It's an important concept. I'm going to talk about that a little bit later when we get into the final conclusions to the podcast. And then also, one of the important things that the PRP does is it stimulates the follicle papillae. Remember, we talked about this is the trigger to the cells going into the growth phase of the hair cycle. Remember, it needs a trigger. The follicle papillae is the trigger. It's the spot that you say, like, okay, this is when we're going in from the dormant phase, the telegenic phase, into the angiogenic phase, and this is the trigger. So it needs this to be able to do that. So the PRP does help this to go more into the growth phase, which is super important. And then it also remodels the root, and of course this is super important. And we know that platelets do this because of the fact that they're the first responders. They're the guys that are come in, and they are, there to help when damage is done. So, PRP is kind of the, is the cells that are there. They're the growth factors, the stem cells. They're present there to really help. So here are some of the really interesting studies that have been done. There was a study done in Barcelona, and there was it was in 2021, so not that long ago. And what they did was they had patients doing 6 PRP sessions, and so they had men doing the study and female doing the study and men doing the study, and of course they always, with these studies, they had people getting the treatments, and then they had people getting placebo. And so of course placebo, they would probably take the blood and then put some type of product on the scalp that was something other than PRP.
So when they do these studies, what is the treatment that they're doing? So the PRP, you draw a patient's blood,
right,
and you spin it down,
mm-hmm,
to get the platelet-rich plasma,
mm-hmm,
separated, and then you inject that back into the damaged hair follicles.
Correct.
Okay.
So you're injecting it into the scalp, and then you're injecting it into the specific areas that you find, the cells are, or the follicles are, are mostly in either the catagenic phase or the telegenic phase, the areas that are going to be most likely, dormant or going through the phase where you're losing hair.
So what was the result of the Barcelona study then?
So what they did is they they have interesting kind of metrics on how they do this. What they do is they have hair density metrics. So they put a certain number of hair, hair. Like, so you can't really count hair, right? But they take hair density, on your scalp, and then they put this ruler, essentially what it is, and they kind of they use this as a metric to see how dense the hair is over a period of time. And so after 6 treatments, they wanted to see was this successfully increase in hair growth for men or females. And what they found is that for the men, they had a successful group of treatments. What they found is an improvement of hair growth for these men in almost 70% of the respondents that actually did this. And for the females, 73%.
That's amazing.
20% of the respondents said that they felt like it was about the same, but almost 70% of both the men and women felt like that they had significant change in growth.
As opposed to Rogaine was 40% of patients, it worked 100% of the time. So this is 40%.
That's right. That's right. Right. So 70% of the 100, exactly. So, but yeah, so I mean, so that's a significant finding because of the fact that these people went through a series of 6 treatments. And usually the way that these treatments will go is you will treat the person every 4 to 6 weeks, and you'll inject them, with the PRP, which is their own, blood sample. So you're not taking it from somebody else. You usually take their own blood, you spin it down, and you'll use their own blood cells, and you'll inject it back in. So, they found that they had, really an excellent, a really good, really good findings, in this study. So there was another study that we kind of looked at, and this was in the Journal of Dermatology in 2017. And this was a study where they did 5 PRP treatments. Again, there was, the patients were, again, placebo versus the people who got treated. They did a series of 5 treatments against every 4 to 6 weeks, and they were checking for the outcomes they were looking for is the density and the diameter ratio, which means that the diameter of the amount of hair that was grown within that was grown into these patients. And so this was kind of an interesting study because of the fact that they were looking to see whether the hair was not only present, but was the hair actually thicker, and was the hair actually longer, which is something that a lot of times when you look at some of these studies and some of the outcomes, you say, okay, well, you grew baby hair, is that enough of what you really want to achieve? So this study actually, in the Journal of Dermatology, they were looking at longer and thicker hair, and they found that in a large percentage of the respondents after 5 treatments of the PRP, they not only had hair that was grown, but they found that they had a large diameter and much longer hair that was grown than even their hair that they had on their original scalp. That was there prior, not even, not the hair, obviously the hair that was lost, but the hair that was there before that was present.
That's amazing. So
Yeah.
they had thin hair before,
Right.
or it was starting to go gray, then it was darker and thicker than it was before.
That's correct. Yeah.
That's amazing.
Yeah. So there was another study. Now this was in the Journal of Molecular Science in 2020. And this was a study that was done against minoxidil. So this is, we love these head-to-head studies because we always love the competition, right?
And minoxidil is Rogaine, right?
That's right.
Okay.
And so this study was interesting because of the fact that this study kind of looked at so this study looked at the minoxidil grew versus, this was a PRP versus minoxidil. And so this study kind of looked at both, and we were looking at which was going to have a better density, which group was going to have a better density group and more dense hair, and which was going to grow quicker and longer. So this was a 2020 study. This is a Journal of Molecular Science. What they found was that the study, and they had three groups. They had one group that had minoxidil alone, one study that had minoxidil with PRP, and one study that had just PRP. And they found that the study that had PRP with minoxidil actually had the best respondents, that had the largest, thickest, most dense hair in the group. The group that only had minoxidil did have the thinnest, the thinnest group. So these studies were really interesting because I think that one of the important points that we kind of should look at is the fact that it's important to really understand that alone these different types of modalities have some really good efficacy, but even better is the fact that they will actually have some really good modalities even together, and together is really kind of the combination therapy is even better than just alone.
That sounds like the magical elixir.
Yes. So we're going to go into the next grouping, but we're going to take a quick break, and then we're going to get ready to talk about the next grouping, and then we're going to get into the final conclusion. So we're going to take a quick break, and just give us a couple minutes, and we're going to go right into it. So hold on. Okay, so now that we discussed the platelet-rich plasma, which is one of the really exciting topics of hair replacement. I mean, I find that platelet-rich plasma is really there's a lot of studies, there's been a lot of data, and I think that there's been good results. We've seen good results. Just like everything else, though, I think that doing things in combination is really kind of the best kind of strategy. But I think platelet-rich plasma has shown really good data. So I think that is, that's definitely something that, is high on the list of positive results that we've been seeing. We're going to go into the next topic, which is something called exosomes. So exosomes is kind of the new kid on the block.
Okay, so what is it? How new?
So exosomes have been around. I mean, exosomes, I guess, have been around since the dawn of time, actually.
Okay.
But use of exosomes have not been around since the dawn of times. It's been around only since recently that they've been realized that you can use these specialized cells in the body and actually use them for your benefit. So you kind of think of exosomes, what they are these little cells that move within, from inside our cells, from one part of the cell to another. And so they're kind of like the little postman that could.
Okay.
Yeah.
All right.
And so the cool thing about exosomes is that they have a little kind of lipid bilayer, which is kind of like a little fat bilayer, and it moves around, and it's kind of like a lot of times it messages things, like it sends messages from one part of the cell to another, and it kind of says, hey, you need to do this and you need to do that. Like for nerve cells, exosomes are really good at saying, hey, you need to create this message so that way, an arm can move, a leg can move. So it has some pretty good function. It could have genetic material in it. It could have waste in it. It's when the cell wants to get rid of stuff. So exosomes are pretty effective materials within the cells. But now they're figuring out, hey, we can use these exosomes for our benefit.
For what's an example?
Okay, so I was hoping that you'd ask that. So, what exosomes are being used for now is that if we have material such as growth factor stem cells that we can place in these exosomes, or these exosomes are, from materials that are new, say placenta cells. Placentas, all brand new cells, right?
Okay.
And so they're waiting to kind of build new cells because they're from a fetus, for instance. They're waiting to kind of get in there and kind of like build all brand new cells and kind of repair things and just be great advocates to build structure. And you use these cells to go into cells that were damaged or dormant or things like that. You can really have some really beneficial results with these types of cells. So if you can harvest these cells, and because the exosomes have a protective bilayer, you could actually inject those exosomes directly into, say, a scalp and use those cells to actually repair some of those damaged cells.
That sounds amazing.
Yeah. So that's exactly what we're talking about now. Like, you could use it in the skin, you could use it in the scalp, you could use it in multiple places. Now, the exosomes can come from different places. They can come from the placenta, they can come from the bone marrow, they can come from sometimes platelets even. And there's lots of different research is going on right now. There's research at the Mayo Clinic where they're harvesting platelets, and they're taking the exosomes from these platelets, and they're kind of seeing, since we talked about how platelets are the first responders, right?
Mm-hmm.
And they're using these exosomes to actually affect change, for kind of damaged wound, scarring, and and they could use it for scalp as well. So it's pretty incredible idea. It's pretty incredible stuff, and so it's pretty exciting because of the fact that you're using something that is fresh, something that has the ability to last longer because of the fact that you have the protective bilayer of these exosomes, and it's got regenerative material. Now, wouldn't it be even more amazing if you could put something in these exosomes, like, say, genetic material, to say you need to kind of wake up, this dormant cell and deliver it right to the scalp?
Wait, can we do that?
Not yet.
Okay.
But they're working on it.
That sounds amazing.
Yeah. So that's really kind of the next level of what the exosomes kind of are working with. So that's
super exciting.
It is super exciting. So it is really kind of like next level, cutting edge stuff. I mean, but really kind of the research, research out there for exosomes are new. So, I mean, there's not a lot of research. I mean, we have to be very kind of cautious with all research that you look at. Look, people, like if you Google things, online, you could find things that will make your case, or you could find things that will go against your case all the time, because looking at scientific research articles is very hard if you're not a scientist or you don't understand scientific data.
Right.
And that's really the thing that I warn people greatly about, because of the fact that, trust me, sitting in those classes, trying to learn how to read a scientific article, and the worst part is waking up at 6 o'clock in the morning, going to journal club in medical school, and having to sit through these articles, and then having to comment on the article at 9 o'clock, 3 hours later, when they would say, Dr. Frankel, what do you think of this article and the efficacy of the research? It wasn't so easy. Trust me.
I believe you.
So being somebody who's never had the ability to, or never had this training, and never had the never had the education on how to do this, and never had the pain of waking up at 6 o'clock in the morning and sitting through journal club, it's really difficult to kind of weed through this data. So
I appreciate you going through it for us.
You're very welcome. You're very welcome.
Translating it for us on the Modern Man podcast.
Your appreciation is well taken. But there are a few studies that I'll talk about. And again, you have to take these with, they're small studies. There's not a ton of studies. But there was a study done in the Journal of the Cell in October of 2021. And it was looking at the dermal papillae, and it was exosomes versus placebo, which means that exosomes versus, they put some type of material that, had the same consistency of exosomes, and they injected it. And they did find that, that with the exosomes, looking at like under fluoroscopy, which means that they looked under like a special light under the scalp, they saw that, the activity of the scalp was 2 to 3 times greater than, than with the exosomes versus not. So, I mean, that's pretty significant finding, that the scalp was more active, meaning like there was more, there's more vessels growing, there's more activity, and so that is going to show that there's more, the more activity. There was a second study back in 2020 that was exosomes versus minoxidil, and then there was a study that then exosomes plus minoxidil, and they did kind of looked at, and this was a study done with mice again, and they found that, looking at the different phases of the mice and the hair cycles that the mice were in, that the mice that were in the exosomes plus the minoxidil were at a 2 times greater times that they were in the anagenic phase versus either the placebo versus the exosomes alone.
Oh, that is impressive.
Yeah. So again, the hairy mice, are out there. I mean, you probably could find them, but but they're definitely present. And so there's plenty of research set to come. And here, at the Modern Man podcast and at Simply.Aesthetics, we're doing our own research because we are very excited about this topic.
If you can't tell, we're very passionate about this topic, and we want to bring great results to everyone.
That's right. So we find that, the only way to really kind of get the best results, though, is to kind of take all the, take all of the most impressive, or the different types of treatments that have efficacy and combine them. I mean, why not, right? Why not,
Absolutely.
right? Like, why would you do anything less? So, I mean, here's some of the things, the bullet points that we're going to kind of break down, and from this 3-day journey of the podcasts. And thanks for kind of sticking with us. But let's get to the high points of what we said.
Let's do it.
So again, the most important thing is to start early, because what did we say? By the time you actually notice that you have some type of hair changes, how far along are you?
You're already damaged. You already have damaged follicles at minimum, right?
And you're probably at what percentage would you say?
Ooh, 50%.
Yeah, almost at 50% hair loss. Yeah. So I mean, that's a significant amount. So we want people before they get to that point. But even if they do get to that point, they're not too far gone. That's definitely the time to make a phone call. So start early, and if you start noticing changes, if you start noticing thinning, that's the time to start working. Start working on it. Prevention, of course, is the first kind of easy step to stop everything. And prevention means, don't do the things that are going to kind of cause hair loss. Don't add to your problem by using harsh shampoos and conditioners, things that have preservatives in them. Use things that are nourishing, not things that are caustic to the hair.
That makes sense.
Don't use hairstyles that are going to create traction to the follicles, that it can actually scar them and permanently cause damage to the follicles.
And I imagine avoiding heat. So tools like a hair straightener, dryer,
right,
curling iron, those things can be detrimental.
Absolutely. So you got to be super careful. And if you're going to use these things, you have to be wary of the fact that you might be damaging it, and you could just turn down the temperature to that one level that's a little bit less than where it was before, right? So the other thing is that with hair loss, there is definitely certain medical conditions that can cause hair loss. So it's always important to, for sure, make sure that you're not having one of these conditions that can be treated. But also, there's two types of specific hair loss that we'll be talking about: the androgenic hair loss and the telogen effluvium. The telogen effluvium, which is more transitory due to stress, but what we said is that this can become more permanent.
Absolutely. So even if it's stress, hair loss can cause damaged or scarred follicles.
That's right. And it could end up turning into more permanent problems. So if you're noticing that you're having issues, then, like we said, make sure you get right on it, and and get evaluated and see, is this a medical condition, or is this something that I need to kind of take care of right away? So I mean, although there are different products, and different efficacies, the best way to kind of go through this is the efficacy of single products are, there's definitely good results for each one. And like I said, as we talked to on the first day, so that, for instance, minoxidil has a 40% efficacy, which
is Rogaine.
Correct. Correct.
tagging along.
And so that doesn't mean that it only works 40% of the time, like it only works on 40% of your head. What that means is that for 40% of the people, it works 100% of the time.
Right. It doesn't work for everyone, just 40%.
Correct. So, and that's true for a lot of these different products, but that there is no true silver bullet. There's no true, you know, problem that, there's no true solution that works all the time. And even with transplantation, there are issues, and there's not permanency for all of these conditions. There's, rejection, there's infection, and there's also, problems with certain transplantation as well. So, you have to understand that, there is no silver bullet with this problem, but we can get, to better efficacy with combination therapy as much as we can. And I think that is the approach that we take here, and that's the approach that I think is the best kind of way to go forward. So minoxidil alone, like I said, or Rogaine, has a 40% efficacy. Now, if we had ability to enhance those results, would we do it?
I would hope so.
Of course we would. So, for instance, here at Simply.Aesthetics, in combination with Modern Men, we decided that we were going to increase the efficacy by adding things that not only are going to help the hair growth phase, which minoxidil does, but also decrease the hair loss phase. And some of the things that we do are helping that by decreasing the inflammation in that phase by, for instance, adding retin A, alicylic acid, and hydrocortisone. So there are things that we add within our formula that actually help to increase the efficacy of our own minoxidil or Rogaine formula. So it's not really called Rogaine in that phase because of the fact that we
are adding something else to enhance the minoxidil.
Correct.
Okay.
So we have better efficacy than just minoxidil over the counter, because we're taking the minoxidil, we're using the additive, so that way we enhance the results.
That sounds amazing.
So that's the first thing. So I think that the minoxidil plus formula that we use is a good start for sure. The low level light therapy as well, I think has really good efficacy. We talked about the low level light therapy. What it does is low level light therapy, red light therapy, cold laser, whatever you want to call it, laser cap, all these types of things. What it does basically is it heats up the scalp to a certain point, but not too much. That's going to increase the vascularity of the scalp. And what it's ultimately doing is it's increasing the blood supply. It's going to increase the flow. It's going to increase the ability or the trigger for the dermal papillae to trigger the dormant follicles to produce more hair growth. And the efficacy in many research articles has shown up to 80% increase in follicle growth.
Wow. So that's just the red light laser, like caps, but you have to do that several times a week.
Right. So I mean, there's a protocol for it, and so like here we have patients come in, and we have them come in and they do it here. We have them come in, 3 times a week.
Right.
They pop in for a few minutes a week, and 6 to 12 minutes, and they pop in, they pop out, say, "Hey Zoe, I'm coming in for my red laser," and and they get their a little bit of light, and they walk out, and
that's amazing.
And their follicles are being stimulated. So So that's a second, that's the second phase of the light. PRP, of course, we talked about, you know, at length here and on other podcasts. PRP essentially platelet-rich plasma. What you're doing is you're taking the blood cells, you're spinning it down to the rich platelets, and you're re-injecting it back into the scalp. We usually will numb the scalp before we do this. Of course, we talked about the first PRP treatment I had a few weeks ago. Miss Producer thought it was a good idea that I didn't need my scalp numbed. so I did okay.
I think you were still a good sport about it.
I was, yes, I was. But she said that I would be fine and just started injecting me. But we usually do give you some numbing before we do that. But even still, I could tell you that even without the numbing, it wasn't really that bad. Especially if Joanne injects you, because if you do whine, she'll yell at you. So it's
no big deal.
No big deal. So it usually helps to kind of not feel as bad about it. And so what this is doing is it's taking the PRP, bathing your follicles with these growth factor stem cells. It's creating the depth of the dermal papillae, growing them, allowing the follicles to be enhanced, as well as helping the phase of the anergetic phase to be elevated and decrease the range to go into the catagenic phase. So I think it's, there's been tons of studies on it. I mean, we've seen great results, and PRP is definitely, doing it, and we've kind of come to the thought that 4 to 6 PRP treatments, kind of that range, the research is showing has been kind of range that we're kind of like going to. Doing it every 4 to 6 weeks is usually the best kind of course of action. In conjunction with doing the minoxidil, the red light therapy, adding also biotin, which we talked about as well. Great vitamin, doing injectable biotin, getting the best type of absorption by doing injectable biotin. You'll get the best chance to get good biotin absorption. So if biotin is going to give you that effect, that positive effect, you want to get the best results, because most water soluble vitamins that you take orally, a lot of it you're going to end up excreting out.
Right, you don't absorb all of it.
Right. So that dark yellow P that you see when you take a large B vitamin, that's most of the B vitamin that you just ingested. So the injectable biotin, you get a really much better result.
Passes the GI system.
Right. So he goes past that and you take it in. And finally, exosomes, the new kid on the block. And and we're definitely doing some research with exosomes. The downside with exosomes is that it's a little bit more expensive because of the fact that with PRP, it's you bring your own blood, and we extract your own blood and kind of we'll harvest that. With exosomes, we get the exosomes from other suppliers, and so the exosomes are definitely a little bit more pricey, and the research is still a waiting game. But I mean, the science is definitely very promising, very exciting. We did amniotic fluid facials back about 5 years ago. I don't know. Do you remember that?
I do remember those.
Yeah. So, but
a little weird to me to.
So the
wrap my
amniotic,
brain around.
yeah, the amniotic fluid facials, the results were outrageously good. The problem with that was that, like, the handling the amniotic fluid was hard because it was so delicate. Like, you literally had to get the amniotic fluid on ice and you had to open it, and it could only be good for like 30 minutes because of the fact that it, as soon as it defrosted, you had to use it, right? The positive thing with exosomes is because it has that lipid bilayer, you have more time to be able to use it, so it's more stable.
All right, that sounds good.
Yeah, so that's kind of the interesting thing. So, like, my feeling, and our feeling is that combination therapy, because of the fact that, everything kind of works best when you work together, is best for this type of problem. Moxidil, biotin, laser light, and advanced treatments, whether it be PRP or even exosomes at this point, will give you the best results, and that's what we're going with. That's what we are advocating for, and that's what we feel are going to give the best medical results for hair loss, and that's our protocol for hair restoration here at Simply.Aesthetics.
Fantastic.
Yeah. So it is the end of our series.
A 3-part saga. But there's so much to talk about that we wanted to make sure that we packed all this great information in.
I mean, that was almost, 2 hours plus of podcasting.
It was worth it. I learned a lot.
Yes, it was exciting. But I think that for the most part, I think it was important information, and I'm happy that we got to give that to you. If this information is important to you, please like, share, and comment. And if you have questions, please send the questions to us. Zoe will answer.
Yes, I will.
And next week we have a very exciting podcast.
Even more exciting than treating hair loss.
You think so?
I don't know. We'll see. Dun, dun, dun.
Yes. Well, I think I really wanted to get the next podcast in before October ended, but I think it's fine.
I think it's a topic that's always relevant.
Yes, but I think that it's going to be lots of fun. I really think that it's going to be a visual topic. I think that the last patient we saw yesterday, I'm going to use some of the visuals from the last patient we saw yesterday.
Oh boy, can't wait.
For that topic, because it might be relevant to.
It's a good one, guys.
It's really good. It's really good, and it's going to be very thought provoking, and it's going to be a little lighter than the PRP treatments, but still going to be very important, I think, in the big scheme of things, big scheme of life.
Absolutely.
Yeah.
Thanks for listening.
Yes.
For all 3 episodes, and for always listening.
Yeah. So
to the Modern Man podcast.
Yes. So thanks again, and we will see you next week.
Bye, guys.
Bye.